Welcome to Case Management Guide to EIS. Today's presenters are myself, Linda Micah, CCM Liaison in the Portland office, Angela Duff, CCM Liaison in the Bangor office, and Cheryl Guimont, a CCM Liaison in the Caribou office. EIS, or the Enterprise Information System, is the data system that ODES is using at this time. However, a new system called Evergreen will be available in August of 2021. Stay tuned for Evergreen training in the new year. To obtain a certificate after this training, request a knowledge check from the following liaisons: myself, Cheryl, and Angela. After completion of this training, case managers will have an understanding of how to navigate the EIS data system, be able to access and complete the various assessments found in EIS, and have an understanding of the reportable event process. EIS basics. This is a screenshot of the My Events page. It will have a list of your clients to the left, and then list all reportable events that you need to review on the right. Click on the blue link to anchor your client. The top bar will have that person that you are anchored on. The purple menu to the far left will include the home page, My Events, Search, Assessments, Authorizations, Notes, and Reportable Events. You will also see a link at the bottom of the page to set your preferences. This will enable you to have all your clients show up on your My Events page. Setting up your client preferences. This will add a client to the EIS front page under My Clients. Click Set My Preferences on the home screen. Select Client Preferences in the drop-down show menu. To add a client to your front page, select Client from the available clients and click the arrow to move over to the selected clients. To remove a client, you can select your client from the selected clients box and click the arrow to move them over to the available clients. Always click Save after any changes. Printing all client information. Printing a client information report is helpful for case managers to have all pertinent information on their clients easily available, such as alerts, emergency contact levels, and guardians. Click on the client ID number. This will bring you into the client information. Click on the printer icon in the top right corner. In the pop-up, click the All Client Information Report. EIS show menu. To get to the main client information show menu, click the blue client ID number. To anchor a client at the top of the screen, click the blue Go. To the right, you will have the show menu. In the show menu, you will have different options to click on: addresses, people critical information lists, people demographics, enrollment status, etc. And we will review each one of those in the next few slides.
The show menu is located at the top right of your screen. We will be going over those fields located in the show menu that case managers access and need to update most frequently. The show menu includes addresses. The address listed here should be the most current address for your client. You must have both mailing and legal addresses listed. Click Add to enter a new address. When an address is no longer needed, click on the blue address and enter an end date instead of changing address. Clicking on the blue address and entering an end date allows for a history of addresses to be retained in the current file. Critical information is also an important feature of the show menu. In order to ensure the highest quality of service possible, information about the participant must be readily available and accessible in EIS. Case managers are responsible for entering critical information into EIS and for reviewing and updating this information annually during the PCP process and as changes occur. Critical information for the client, such as medical conditions, allergies, important contacts, emergency contact levels, etc., should be updated annually with the plan. Critical information is used by anyone who needs to access important information. It is used by crisis team staff who may need this information after hours or when transferring a case to a new case management agency. Important critical information to update should include the presence and status of acute and/or chronic medical conditions like diabetes or seizure disorder. All this information should be documented here in critical information. It is important to note that when the liaison team completes an agency recertification review every 3 years, we check that any medical information and emergency contact information has been updated with the plan. You can do this by adding a date that it has been reviewed and updated next to the corresponding field. To add anything to critical information, simply click the Add button and select from the drop-down menu. Critical information also includes emergency contact information. Emergency response rating is a system in EIS that identifies participants who would be contacted first or who would be prioritized with authorities in an emergency evacuation. This is used by the crisis team, case managers, and supervisors in an emergency evacuation or public emergency such as a hurricane, flood, ice storm, or other public emergency event. The emergency response rating also identifies participant, family, and providers' responsibilities for providing immediate support if needed. How to add emergency contact. Under critical information, click on the Add to create a new emergency contact. Click on the existing contact to edit a current relationship. Select correct contact level and add description. Emergency contact levels include level 1, immediate contact, living alone and will need assistance to evacuate by authorities. Level 2, secondary contact, living alone or in a situation where the person can potentially evacuate on their own but may be vulnerable. Level 3, supportive contact, receives limited support, less than 20 hours per week of personal support. Level 4, provider contact, receives significant or full support from a provider of service, and the provider is responsible for level 1 and level 2 contact. Level 5 is anyone living with family, lives with family who is responsible for the immediate health and safety of the individual. The show menu also includes people demographics. This is where you would include a name change, any basic demographic information, and where you would also enter the death date. The show menu also includes people identifiers. This is also where you would find a Medicare number, Social Security number, or a main care ID number. The show menu includes relationships. This is where you will find anyone who has any type of relationship with your client. Family relationships, case manager, provider responsibility, guardian, and/or rep payee. It is important to keep this updated and current. Please keep in mind that the case manager relationship should have 2 addresses listed, the mailing and the work. If they are the same, list both. The guardian relationship should also have 2 addresses listed, the mailing and legal. If they are the same, list both. Adding a relationship. Click on the show menu, click Add, select the appropriate relationship, which is typically individual. This will populate a list for you to choose from. It will take a few seconds for this list to appear. Type the last name of the person you are searching for
in the Find box. If the person is not on the list, you can add them by clicking Add. This will produce a box for you to complete. Select the type of relationship, enter the start date, and click Finish. Printing a SAS, a summary of authorized services. You will anchor on your person, click Authorizations in the blue menu bar, and a list of all authorizations will appear. For the current one, you would click the radio button for current and then click Go. When the current list appears, click the Printer Friendly button. At this point, a box will appear. Select the X360 summary to bring up your SAS report to print. In the event that you receive an error, please contact your local IDS person and they can email you the current summary of authorized services.
Maine delivers 2 Maine Care home and community-based waivers for adults with intellectual disabilities and autism. These are referred to as the Comprehensive Waiver Section 21 and the Support Waiver Section 29. If you are a case manager working with someone who needs the services under one of these waivers, you will be completing the application process for either Section 21 or Section 29 waivers. In assessments from EIS, the DS Comprehensive HCB waiver is used for Section 21, which is the first one you see here. And the second one is the DS Support HCB waiver, used for applying for Section 29. When applying for one or both waivers, please make sure you are using the correct waiver assessment. These are also sometimes referred to as the BMS 99 assessment. You will also need to update these assessments annually to maintain these services as part of the annual waiver reclassification protocol. Once someone is using either Section 21 or Section 29 waiver services, once they're completed, you will find them in assessments. When you pull them up to complete the reclassification, click on the reversion toggle at the top of your screen. Please note that you do not lock this assessment, as the resource coordinator will do so once they do their part in the assessment. This is a screenshot of what the top part of the assessment looks like. Ensure that you are filling out each field to the best of your ability. When filling in the diagnoses, enter the diagnoses relating to IDD or autism first, then all other mental health or mental diagnoses if there are any. The Office of Aging and Disability Services also offers Waiver 101 training that provides more detailed information and guidance about this process. Reportable events. In the event that you as a case manager are required to fill out a reportable event, click on the Reportable Event tab on the blue menu bar. To add a new reportable event, click Add. Put the correct date and add a title. It is not necessary to edit the time. You can enter a brief narrative here, as you will be providing a complete narrative in the body of the actual reportable event. Please refer to our online reportable event training for more detailed information about this process. Reportable events. All fields must be filled out, even ones not in red. The data enter provider agency must be added. Be sure to include data enter email address and correct phone number in case we need to contact you. You must answer reportable event questions after the reportable event is filled out and saved. Click on the Show menu inside the reportable event and select Reportable Events Questions. This field will not let you go to the second part of the questionnaire until all required fields are entered. You must fill in the second part of the reportable event. The second field in reportable event includes reportable events questions. Answer all questions thoroughly. Be sure to save each page of questions individually. Toggle between each page of questions. You will have one page for each category you selected on the main first reportable events page. Reportable events notes. You may attach notes to a reportable event by selecting Notes List under the Show menu of the main reportable event. To create a new note, click Add on the main notes page. Select the correct type of note and click Finish. Be sure to attach this note from the corresponding reportable event, or it won't properly attach. This cannot be done after the note is done incorrectly. A new note would need to be added. Be sure to fill out the body of the note with all pertinent information. Important things to keep in mind when reportable events are reviewed. Ensure that all notes relating to a reportable event are attached to the corresponding reportable event. Notes need to indicate whether there was a discussion with the provider about remediation action steps that needed to be taken. Remediation action steps are those steps taken to decrease or eliminate the chance of incident reoccurrences. Notes also need to indicate whether the case manager had a discussion with the member or the guardian about any remediation action steps taken. If remediation action steps require changes to the PCP, evidence the case manager reversion the PCP to reflect these changes needs to occur. If you as the case manager generated a reportable event, you are responsible to complete the provider follow-up within 30 days of the reportable event. On the reportable events assessments page, under the Show menu, click Add to create a new assessment for a provider follow-up. Select the provider follow-up and click Finish to start the new assessment. Anyone who creates a reportable event must add a provider follow-up report. This is what the provider follow-up report looks like. You write a brief description in the box. Be sure to answer the required questions that are located under the Show menu. Be sure you are clicking on the questionnaire in the Show menu to ensure you are getting to the page of questions that need to be answered. This is the provider follow-up questionnaire. Please be sure to fill out all fields to the best of your ability. Be sure to click Save before exiting the assessment.
Death and mortality review. The death and mortality review must be added within the reportable event for the death of the client. Go to Assessments under the Show menu in the reportable event, click on Add and select Death Report and Mortality Review, then click Finish. Be sure to add any details in the description of the death and mortality review. Click on the questionnaire in the Show menu drop-down and answer all questions. Notify the resource coordinator and the CCM liaison of the client's death. Be sure to answer all questions. Toggle between the death report and the mortality review by clicking on the dimension drop down in the middle of the screen. Be sure to click Save on each page of the questionnaire.
Notes. There is a full action note training located on the ODE's website that will address the content of notes. This slide tells you about how to access the notes section. Be sure your client is anchored at the top of your screen. Click on Notes in the purple menu bar on the left. Click Add to create a new note. Add the title for the note and the correct date, and then click Next. Select the correct type of note and click Finish. Be sure to fill out each field completely. Write the main points of the note in the description. the type of notes, the number of billable units. Click Save when you are completely finished with the note.
Thank you for listening to our presentation. To get a certificate, please contact Angela, Cheryl, or myself and request a knowledge check. Thank you very much.